ICT, information communication technology, is already playing a pivotal role in healthcare delivery all over the world and in Pakistan as well. I feel that the advent of mobile health has changed it drastically, and we have a number of active projects in the MHealth space through which we are not only delivering healthcare, but we are also monitoring the disease patterns. We are engaging with physicians and the other healthcare providers. We are changing behaviors of patients. So that's something which needs to be taken very seriously. The role of mobiles, because of obvious reasons, we all know that mobile has revolutionized the way we communicate. So we are using that tool in the healthcare delivery model as well. I feel that we do have telemedicine. We have MHealth projects. We have a medical call center. We have the hub and spoke telemedicine projects up and running since last 10 years or more. But I have to admit that it is still not so prevalent, and we just have a few examples of successful projects, but we have not been able to really take telemedicine or use technology to deliver healthcare, to reach out to the majority of Pakistanis living in the rural areas. Around 60 to 70% of Pakistanis live in those areas which are not accessible, or where there is no access to basic healthcare. So I agree and I admit that we have not been very successful as far as the implementation of telemedicine or MHealth is concerned, or we don't have many applications. But still, we are trying to bring all the stakeholders together, and I feel that once all the stakeholders join together, including the government, the regulatory bodies, the policy people, the industry, academia, and experts in telemedicine, they all have to sit together. I speak in different conferences around the world on e-health and MHealth, and this is a question which keeps coming up, that if telemedicine or e-health or MHealth is so good, why is that we are not using it in our systems? I feel that one of the challenges, one of the barriers, is the buy-in of the physician community to telemedicine, or the level of buy-in which we actually require. Physicians now agree that telemedicine is a way, but they have really not embarked upon or using it so effectively. So the healthcare or the physicians community are not using technology as technology is being used in other industries like the airline industry or the textile or the engineering or automobile industry. So I feel that we need to have a better, more effective buy-in of the physicians community and the policy makers and regulatory bodies of Pakistan. I'm very positive, I'm very optimistic because of two reasons. One is that we have an exceptional need. Like I said, we keep repeating that majority of our people live in the rural areas, they don't have access. As we speak, people are unfortunately dying, not because of cancer only, they're dying because of even inaccessible basic healthcare. So the need is big. So when the need is there, the solutions have to come and address that gap. Like I said in the conference, the first and foremost, the most important thing is that the patient centricity should be maintained, especially in e-health and telemedicine, because a lot of times we have seen, and everywhere in the world we have seen that people get carried away by technology, by the fascinating technology they have, and they lose their focus on the patient benefit, or the patient centricity is lost. So I think that's the most important thing. We all, whether it's the physicians or whether it's the hospitals, nurses, the government, the industry, we all exist to add value for the patient. So the patient should be centric in whatever we do, and if we keep that focus, I'm very hopeful, very optimistic, inshallah, that we will be coming up with solutions for our patients in Pakistan.